Hi friends, welcome to my channel. Today I am here with another case note explanation. So let's see. Assume that today's date is 8th January 2022. You are a community health nurse. One of the doctors requested home visit for your patient, Mr. Paul SHIPTON. Patient details are given. Social history, non-smoker, consume alcohol 10 glass weekly, wife arthritis and depression, mother diabetic. Then medical history, he had high cholesterol in 2014, type 2 diabetes 2017, hypertension 2014 and back pain. These are the medical history given. So from this one we have to see what all relevant information we have to include in this letter. For that we should know who is our reader, isn't it? Still there is another medical history. Stomach irritation, history of ulcer in left leg 2019, treated by compression therapy at ulcer clinic. Hernia repair performed, but it's not mentioned when. Then current medications are metformin, atorvastatin, ibuprofen, amlodipine and omeprazole because he has stomach irritation. Then the complaints. 1st January 2022, he was diagnosed with pneumonia following suggestive symptoms. Fever, feel chesty, antibiotic for 10 days. Community health nurse visit arranged for today. Then 8th January, home visit, recovering well from pneumonia. Feel improved breathing. Then during home visit, on 8th home visit, recovering but feel improved breathing, but there is an ulceration on the right calf, untreated trauma 6 weeks ago following fall at home, failed to inform doctor. From that one it's developed this ulceration. Now diameter of ulcer and pain is increasing. Then during assessment what we have, it looks edematous below knee with the wound. The measurement is written there. So extend to inner ankle. Scar tissue formed in skin bed. Less hemolytic exudates present. Then skin culture taken. Report pending. No obvious signs of infection. Query ulceration with mixed etiology, venous or arterial. Query arterial insufficiency. That is the one doubting. So until now the diagnosis is not confirmed. Then let's move on to the management. What they have done. Cleanse with normal saline, dressing, non-adhesive tape, absorbing bandage, plan urgent referral to vascular surgeon for management. So we understood our reader is a vascular surgeon. So we should know what all information he should get in order to provide the care or to diagnose this situation. So let's see the writing task. Using the information given in the case notes, write a referral letter to Dr. Sophie Mathur, Manager, Vascular Center, Willen Valley, 2nd Street, Melbourne, Australia, for further treatment and investigations. So we are going to write this, even though he is manager, he is the vascular surgeon as well. It is a recent case note which was the exam for question for the 23 July 2022. Here I am not going to discuss about how to write the introduction. You can comment below the comment box. Just try to practice by yourself. Then only your confidence level and the way of writing it will improve. Otherwise, if someone spoon feed you means you will just memorize the templates or the words, but you will not learn how to write a letter. So the introduction should be done by you. The next paragraph, how we can write. You can just start with the chronological order. It's shifted present with the fever like that, but otherwise you can just write like that. On 1st January 2022, Mr. SHIPTON was admitted due to pneumonia, or he was diagnosed with the pneumonia on 1st January 2022 and has been commenced on antibiotics for 10 days, as well as he was assigned arranged for a community health nurse visit after 1 week. That means today, that is 8th January. Then next matter, how we can write: during my home visit today, although Mr. Shimpton's condition has improved, he reported of a 6 weeks history of wound on the right calf following an unattended trauma. Initial wound was developed after a fall at home and he failed to inform the doctor. He is concerned regarding the increasing size of the ulcer and pain. On examination, a wound was with the scar tissue and minimal exudates was noticed. Scar tissue on the skin bed and minimal exudates was noticed below the swollen knee, which is extending to the inner ankle. Consequently, skin culture was taken. However, the report is awaiting. Then you can write the wound is cleansed with normal saline and a non-adhesive tape dressing was done along with absorbing bandage. Then we are referring this vascular surgeon, so we have to write it in the recommendation paragraph. Before that, we can write the social and medical history. How we can write it: Mr. Shipton resides with his wife. He has had cholesterol and hypertension since 2014 as well as type 2 diabetes mellitus since 2017. Then we can write, as his mother is diabetic, you can write he has a family history of diabetes as well. Then since 2017, after that we can write he is managed with metformin, atorvastatin and Amlor along with omeprazole for stomach irritation and ibuprofen for back pain. Then you can write, please note, he has a family history of diabetes mellitus and he consumes 10 glasses of alcohol every week. It is worthy to note that he had an ulcer on the left leg 3 years ago and it was treated by compression therapy. So the history has finished. Then we are moving to the recommendation paragraph. That will be, it would be appreciated if you could assess Mr. Shipton's wound and diagnose and treat it as you feel appropriate or as you deemed appropriate. Then you can also mention that please or kindly note that his antibiotics has to be discontinued after 2 days. That's enough. Then the concluding sentence you can write: please do not hesitate to contact me if you have any queries. Then yours sincerely, because the name of the doctor has given, Tedsterness. After my explanation, how do you feel it? Is it easy to understand? And if you still have any queries, you can just comment below the comment box. I am ready to help you. But what you have to do, you should try to develop your own style and strategies in the letter writing. Then only you can achieve your target score. If you follow someone, the templates or something, it will not give you the required score. So try to practice it. Thank you for supporting. Thank you. Bye.